This is not a new idea. This legislation has been pursued successfully in some other states. It is responding to a public health crisis, really a public health epidemic. And that epidemic is child obesity, leading to diabetes, heart disease, dental caries, cavities, and other health impacts. The health impacts are serious, and they're costing us literally millions and billions of dollars every year to treat. And for many of these conditions, it is the treatment of illness and disease, and it often reaches a point where it's ultimately irreversible. There is a public cost to treating the impacts of this unchecked trend of quadrupling childhood obesity data. Added sweeteners are the primary culprit in this public health epidemic. Added sweeteners found in soda drinks, sport drinks, certain teas, and available and promoted openly and priced to sell, advertised to sell, targeting youth. These drinks have zero nutritional value. People say today if it's sodas, tomorrow it'll be hamburgers or French fries. There's other foods that we have to monitor, but there's nothing that has zero nutritional value with such high caloric content. So how would the tax work? The tax would impose a 1 penny per fluid ounce of added sweetener beverage as an excise tax. In other words, the manufacturer would pay that with the expectation that it would get passed off to the consumer. We have hard data, good science, that shows when you increase the cost, you decrease the consumption. The reality is, if we don't act now, we're all going to pay. Every taxpayer in this state will pay for the unchecked costs of obesity leading to diabetes, heart disease, etc. So there's no way out of this predicament that will not cost us. We think this approach is actually the most cost-effective measure to reduce those long-term public health impacts.